Visit public hospitals only if necessary. That's the word from the Health Ministry. Otherwise, the ministry wants persons to utilize their local health center first. On Friday, the Health Ministry announced that over 260 patients are waiting on hospital beds at 18 facilities. The University Hospital of the West Indies, the Cornwall Regional, Spanish Town, and Savannah Lamar hospitals have the highest number of patients waiting on beds. The caution comes amid the declaration of a dengue outbreak, which the ministry stated in a recent release is in part responsible for the surge, with 150 dengue-related admissions island-wide. The health ministry says the flu and other respiratory illnesses, as well as traumatic injuries, are also causing more persons to be showing up at hospital doors. The Southeast Regional Health Authority, SERA, is responsible for the administration of health facilities in Kingston, St. Andrew, St. Catherine, and St. Thomas. SERA's acting director of technical services, retired Major Dr. Susan Wright, says that dengue isn't quite to be blamed for the increase.
This is in keeping with what normally happens at this time of year. The cases that you see are not necessarily relating to dengue or COVID, but other cases of respiratory illnesses that are significant enough to be seen at a hospital and significant enough to require admissions. And of course, our usual admissions from non-communicable diseases and accidents, road traffic accidents, and interpersonal violence resulting in injury.
Dr. Wright adds that some patients who need to be admitted may have to wait up to 2 days for beds on the wards.
Certainly, we find that at the Kingston Public Hospital, the Spanish Town Hospital, and the Bustamante Hospital for Children are the main hospitals in the Southeast region that are affected. For example, you do have patients who end up needing admission to hospital who may end up having to wait a day, 2 days max, hopefully not more than 3 days in order to access a bed. However, those numbers are usually decreasing as there is just a slower transit time onto the hospital wards. The hospitals have made certain adjustments, so they would have added beds and cots and cribs to emergency room areas to facilitate comfortable waiting for the persons who are to be admitted onto the wards.
She's advising persons who may be experiencing light symptoms of dengue and other illnesses to check in with their health center rather than heading straight to the hospital.
We're not asking persons who are feeling severely unwell to stay away, but certainly if you're having a milder form of presentation of the illness, that you would seek care at your primary care institution.
Peter Gay Coombs, CVM News.